The woman's body was perfectly fine, yet she claimed she was about to die just as the intern was about to argue back. The woman suddenly had a seizure and collapsed to the floor and was incontinent, with green urine flowing out. This bizarre symptom was something even the doctors had never heard of. They immediately gathered all the doctors for a consultation, and collectively concluded that the reason for the woman's green urine was possibly because she had taken something she shouldn't have. When they went to the woman's home to look for clues, they found a bottle of Ogalon. It's a medication used to treat Alzheimer's disease, and one of its side effects is that urine turns green, combined with the fact that the woman was a nurse. House finally realized the woman might be faking her illness. He immediately grabbed a flashlight and headed to the woman's room, then shined it repeatedly and directly into her eyes and deliberately said it could trigger a seizure. Sure enough, the woman quickly started rolling her eyes and shaking all over. Little did she know House already had his answer. He grabbed the woman's hand and rubbed it against himself. Only then did the woman have no choice but to stop faking. But when House told her to get out of the hospital, the woman said a cat had sensed she was about to die, and she needed a full body checkup right away. House didn't buy it at all that a cat could predict someone's life or death. He thought the woman was being superstitious and didn't take it seriously, but an hour later, the woman actually came back to the hospital with that cat and pulled out a videotape saying, "Everything about the death cat secrets is in here." But before she could even finish, she started having trouble breathing and collapsed. House examined her and immediately knew something was wrong. The woman's bronchial tubes had gone soft. That kind of symptom can't be faked. A perfectly healthy woman suddenly showing such serious symptoms. Could it really have been predicted by that cat beforehand? House immediately watched the death cat's videotape and only then realized what the woman had said was actually all true. Whoever this cat curled up next to would die very soon after. That's why people called it the death cat. Over the past year, it had successfully predicted the deaths of over a dozen people. To test the death cat's ability, House immediately brought it into the coma ward to run an experiment and placed it on the first patient. The death cat didn't lie down, but when placed on the second patient, things went sideways. A patch of red rash suddenly appeared on the patient's arm. The doctors immediately pulled up the patient's medical records and found he had a severe allergic reaction to cats. House quickly gave him an injection of antihistamine. Just as everyone was relieved it was a false alarm, they suddenly noticed the death cat had already curled up on the fourth patient. So they immediately pulled up patient 4's medical records, but his condition was stable and there was no way anything would go wrong anytime soon. House concluded the death cat had no so-called ability to predict death and told the doctors to treat the woman as a regular patient. Little did they know this would turn into a disaster. The woman who had been treated not only didn't get better, but her urine had turned an abnormal shade of brown combined with new symptoms appearing. House was convinced the woman had colon cancer, but after performing a colonoscopy on the woman, no tumor was found. House then suspected the cancer cells had already spread to the intestinal wall and told his team to check the woman's melanin flow. But the results once again proved that House's diagnosis was wrong this time. The doctors all agreed that the woman was perfectly healthy. The symptoms she was experiencing were most likely just a fear of death. It was all in her head. So House brought the woman to the coma ward because the cat had been lying beside patient for the entire day. While the patient's condition remained stable, he wanted to use this to show the woman that the cat didn't actually have the ability to predict death, but the woman wasn't convinced at all. She told House that based on what she was seeing, patient 4 would be dead by tonight, and that she herself wouldn't make it past tomorrow. Faced with a patient this superstitious, House had no idea what to do. He figured time would prove everything, so he stopped pushing the matter. But sure enough, that night, House was woken up by a notification. Patient 4, the one the cat had been lying next to, had died without any warning, and the woman had also developed new symptoms. Her back had broken out in a dense, net-like rash. This was a classic sign of Cushing's syndrome. If treatment wasn't started immediately, she wouldn't survive the day. Everything the woman had said that morning turned out to be right. Could this cat really predict when someone was going to die? But right at that moment, the doctors had no time to think about the cat, because they needed to act fast and schedule the woman for surgery to remove part of her pituitary gland, even though it would leave her with serious complications. It was the only way